So class of 2016, I'm delighted to be here with you today. Later in the program, we will hear from Dr. Thomas Geisbert from our Department of Microbiology and Immunology. Graduates, I think it is entirely fitting and wonderful that you've chosen Dr. Geisbert as your keynote speaker. And this is because I think he's an example of what medicine so desperately needs at this time: innovators. Dr. Geisbert is one of the world's foremost authorities on infectious diseases. In 2014, he was one of the nation's preeminent Ebola fighters who were named collectively as Time Magazine's Person of the Year. I believe Dr. Geisbert will tell you that the life of an innovator is not all reward and recognition. Like leading scientists before him, he has faced many challenges in his career. He probably has endured lack of interest and support for some of his vital work, and I'm sure he will tell you that he failed many times before he succeeded. But Dr. Geisbert pursued his work relentlessly, and because of this, his efforts have helped to save lives. Healthcare is undergoing what are the most profound changes I think we can say we've seen in many lifetimes. In today's increasingly complicated and ever-changing healthcare environment, it will be the innovators that will lead the way. You've worked hard to get to this point. You've undoubtedly made sacrifices in order to pursue your passion. But you have the opportunity to use the training you have received to change how medicine is practiced and provided. There are many ways that you can meet this challenge. You can pursue discovery research like Dr. Geisbert, who works to save lives by finding the next breakthrough treatment or vaccine. Perhaps you will lead advances that expand access to quality care. Maybe you will conceive of better ways to educate the physicians of the future. Or, equally important, perhaps you will role model and champion truly patient-centered, team-based care in your communities. No matter what path you take, I encourage you to rise to meet today's challenges with the spirit of innovation. Let me leave you with one of my favorite quotes: "Audate magnae esse," which means dare to be great. Congratulations to all of you on what you've achieved so far. I'm confident you will make us very proud here at UTMB. It's now a pleasure for me to recognize some individuals that are important, starting with our president, Dr. David L. Callender. We are honored that he will be presiding over our ceremony and awarding our degrees, conferring our degrees later on today. I'd also like to introduce other members of UTMB's senior leadership team who are here with us today. Ms. Carrie King, please stand. There you are. Who serves as our Senior Vice President and General Counsel. Dr. Ronald McKinley is here. He's Vice President of Human Resources and Employee Services. Last, I would also like to introduce other members of the School of Medicine's executive leadership team who are here today. Dr. Michael Ainsworth serves as Vice Dean for Academic Affairs and is Professor of Internal Medicine. Dr. Stephen Lieberman serves as Senior Dean for Administration, Professor of Internal Medicine, and is the John P. McGovern Distinguished Chair in Auxiliary Medicine. Dr. Rex McCallum is Vice President, Associate Dean for Clinical Affairs, and is our Chief Physician Executive. Dr. Niesel serves as Senior Vice President, Chief Research Officer, and is also Dean of our Graduate School of Biomedical Sciences. Please join me in recognizing these fine leaders. The mace that you noticed in the commencement procession bears the seal of the University of Texas and signifies the power and authority vested in the institution. This year, the mace is entrusted to the care of the Senior Faculty Marshal, Dr. Ben Raymer, who is Senior Vice President of Health Policy and Legislative Affairs, Professor in our departments of Preventive Medicine, Community Health, Pediatrics, and Family Medicine. Our chief faculty marshals this year are Dr. Christine Gugliuzza, who is professor in our departments of surgery and pediatrics and holds the Alonzo Alvari Ross, MD, Centennial Chair in General Surgery. Dr. Gail Olson, who's professor in the Department of Obstetrics and Gynecology. Joining them are our other faculty marshals, who are Dr. Lisa Farmer, who's associate professor in our Department of Anesthesiology, Dr. Nisha Garg, who is professor in our departments of microbiology and immunology and pathology, and holds the Robert E. Shope MD Chair in Global Health. We also have Dr. Randall Given, who's associate professor in our Department of Neuroscience and Cell Biology, Dr. Juliette McKee, who's associate professor in our Department of Family Medicine and is assistant dean for student affairs. I'd also like to recognize these faculty marshals: Dr. Anita Mercado, who is associate professor in our departments of internal medicine and orthopedic surgery, Dr. Victor Riaz, who is professor in our departments of pediatrics, microbiology, and immunology, and holds the Mary and J. Palmer Saunders Professorship for Excellence in Teaching. Dr. Giulio Tagliatella is professor in our departments of neurology and neuroscience and cell biology. He's the John Seeley Chair for Parkinson's Disease Research and the Lawrence Del Papa Distinguished Chair in Neurodegenerative Disease Research, celebrating UTMB's 125th anniversary. And last but not least, Dr. Cindy Wigg, who is professor in our Department of Psychiatry and Behavioral Sciences. Please help me applaud those fine individuals. Thank you. Thank you very much.